Hi, my name is Casey Phillips Brown. I'm a licensed clinical social worker and a doctor of social work student at California Baptist University. According to FBI statistics, there were more than 600,000 people missing in 2019 in the United States. Close to 40% were people of color. The majority of them were Black. Black women and girls comprise more than 30% of women and girls reported missing in the US, and yet Black women and girls constitute only 15% of the US female population. Three things contributing to a disproportionate amount of Black women being missing are mental illness/dementia, economic status, and racism. Dr. Kyan Connor, professor of mental health and law and policy at University of San Francisco, states that mental illness is really common in the United States. Nearly 1 in 5 US adults are living with a mental illness, which is about 51 million people. According to Carrie McMichael, the communication and media specialist for Loth Investigation International, adults with dementia are the most vulnerable adults who disappear. In Florida, the concerns about those with mental illnesses who are missing is so high that they created a law to address it. In July, the state passed a new purple alert for people over the age of 26 with a mental, cognitive, or developmental disability who go missing. Financial stress can also lead to a high number of missing people. According to Money and Mental Health Org, Richard Rickford, a research assistant at the organization Missing People National Crime Agency, so this statistics suggest that up to 1,500 people go missing each year because of financial difficulties. Other research puts the figure at near 2,000. The number of people who go missing with mental health issues is larger still. It is estimated that up to 80% of the 180,000 people who are reported missing each year will be experiencing a mental health issue. Debt and mental health and mental illness can trigger each other. We know that people who have mental health issues often find it harder to manage money and budgeting. In addition, the mental health of those who are in debt can deteriorate if they are receiving letters or being harassed by individuals demanding money that they are unable to pay. The HBO documentary Black and Missing addresses the racism that contributes to missing Black women and girls. Missing cases involving African Americans remain unresolved 4 times longer than missing white Americans. Black children are disproportionately labeled as runaways. Predators know that no one will be looking for them, and that makes them an easier target. According to the announcement from the hearing of the neglected epidemic of missing BIPOC women and girls, missing Black, brown, and indigenous women and girls rarely receive the same amount of attention by law enforcement and the media as white women and girls. Empirical studies have identified missing white women syndrome, a phenomenon in which white women are given vastly higher levels of media attention than women of color. And while women are often treated as vulnerable victims by both law enforcement and the media, BIPOC women are frequently viewed as responsible for the situations that they are placed in. According to Slakoff and Fredella, Black feminism is relevant to the missing white women syndrome because certain people who disappear, typically white women, female, and young, receive massive media attention, while minorities who disappear typically do not. It leaves communities and families with increased grief and loss and contributes to the Black community's broken families. Some of the missing women are mothers who leave children behind. The community then has another child without a mother that it has to raise. Of course, according to Stacy Doodle, some evidence suggests that unresolved traumatic grief may affect one's ability to raise securely attached children, thereby perpetuating a generational cycle of trauma and attachment problems. The lack of concern about missing Black women and girls can be seen through the lens of the critical race theory. CRF acknowledges the endemic nature of racism, sexism, classisms, and other symptoms of oppression and their disproportionate impact on racially minoritized women. The wellness of God's world is essential. We are called on to do whatever we can to help with God's work. The wellness of the individual woman before and after the disappearance is essential. The Bible offers guidance on how Christians should respond when there are those in need. This is my commandment. Love each other just as I have loved you. John 15:12. A solution to support missing people and their families is eye movement desensitization reprocessing, EMDR. As a direct intervention, this can be extremely successful in managing and helping those who have gone through the trauma of being either abducted, who are missing, or their family members who are left to deal with the aftermath. According to Francine Shapiro, author of Eye Movement Desensitization and Reprocessing Therapy, since its initial development in 1987, EMDR therapy has been empirically supported by randomized controlled trials and is internationally recognized as an effective treatment for trauma and a wide range of experientially based disorders. EMDR is an evidence-based psychotherapy modality that can decrease depression, anxiety, substance abuse, and other symptoms of trauma. It is also important to note that religion can be considered a support after traumatic experience, and a study on EMDR showed there was a religious change in post-traumatic growth after EMDR treatment. So there are different phases of EMDR. Phase 1, during the client's history, the clinician establishes rapport by obtaining vital information from the survivor or the family member of the missing women or girls regarding the traumatic event. Again, this is looking at if we are using EMDR to help either a survivor of being a missing person or the family members, whether the person survived or not. Okay. A memory, while during phase 1, a memory will be decided upon to reprocess. There may be memories identified in which the client had previous trauma before the missing incident occurred. These incidents may have already created a negative belief. An example would be if a parent has already had incidents in which they believe themselves to be a bad or neglectful parent, and then having a child become missing could exacerbate that belief. Or a survivor historically believing they are bad or unworthy, and then the missing incident occurs, and this confirms their belief that they are bad. In phase 2, this is the preparation phase, which consists of the clinicians preparing the client for EMDR sessions by explaining the theories, testing the bilateral stimulation finger movements, which helps with the reprocessing and creates the change by overstimulating the brain. I'll tell you a little bit more about that later. Seating, and the person who's getting them prepared will focus on the seating as well as creating a safe, calm place and mental container to use as a coping skill. In phase 3, the assessment phase focuses on the clinician assisting the survivor or the family member in exploring the predetermined target memory that will be processed. The client identifies emotions, level of disturbance, negative cognitive beliefs, I am a bad person, and preferably a positive cognitive belief. I would rather believe I am a good person. So they would come up with a negative cognition that they believe about themselves due to the trauma. And then they would say, well, I would prefer to feel and believe this about myself. Then the clinician would do a body check, body scan, to have an idea of how the body sensations are associated with the target memory. Is a client feeling upset in their stomach, in their head, or in other places in their body? Phase 4 is the desensitization done by using bilateral stimulation or another method of BLS, while picturing the worst image of the target memory. So the survivor might have stated that their negative cognitive belief is I am bad. They would hold that belief, I am bad, together with the worst part of the memory, maybe the moment they were abducted or when they were being harmed. The bilateral stimulation would start and the survivor would begin the eye movements. The brain would begin to reprocess the memory while the survivor is focusing on the belief and memory. This causes an information overload and the images loses its emotional charge and starts to lessen. The client might then start to view the memory as a fault of the perpetrator and not as something that happened because they are bad. If the client is able to report a positive or neutral feeling and no longer reports disturbances, the treatment moves into phase 5, which is the installation. This phase focuses on using the bilateral stimulation to strengthen the validity of that positive cognition. I am a good person. And that is something the client would rather believe than I'm a bad person. In phase 6, the body scan explores if the body continues to have a physical reaction when thinking of the memory. And then if it is closed out, you can go into phase 7, which is the closing of the session, whether it's complete or incomplete. If we find that the memory reprocessing was not complete, the next time you meet, you go into phase 8, which is the reevaluation since the previous session. If the client has had more than one target memory that needs to be reprocessed, the process starts again at phase 3. One of the ways the EMDR treatment can be adapted would be to utilize it more via the virtual sessions. Telehealth sessions increased since March 2020 due to the national shutdown of coronavirus COVID-19 pandemic. Studies have shown that EMDR provided virtually is effective in person as well as virtually. Another consideration would be to connect clinicians who are becoming certified in EMDR to the missing person survivors and families through either the Missing Person Foundation or victim of crime organizations. In order to supplement their salaries, fundraising or grant writing could be provided so that these services can be given at a low to no cost to the family members or to the survivors themselves. The EMDR basic trained clinicians who are being certified and the retired clinicians who might help and volunteers who are certified in EMDR would be trained with a cultural humility perspective in mind. These survivors and families are in a vulnerable and emotional state. A clinician utilizing EMDR should provide a safe and empathic environment and hold space for potential mistrust and fear. Supportive supervision increases job satisfaction and enhances workers' feelings of being cared for and considered. If the volunteer and staff feel supported and cared for, they are more likely to provide the same care to the clients.